Senator Bennett's next.
Thank you for coming back, and thank you for your service. As you know, Congress acted in a bipartisan way to address surprise medical bills through the No Surprise Act in 2020. I worked with Senators Cassidy and Hassan on that legislation. We built a big, broad, bipartisan coalition, and we hope to ensure a level playing field between providers and insurers as they resolved payment disputes. And through the dispute process that we set up, both parties were supposed to be able to provide information specified in statute, and the arbitration entities were required to take this information and weigh it equally. But we have heard a lot about how the implementation has been challenged, and to be completely plain and simple about it, Mr. Secretary, we believe the administration is not implementing the legislation as intended. We're seeing lawsuit after lawsuit from providers. Insurance aren't responding in a timely manner, or sometimes not at all. And even when the payment determinations are won by providers, payers still don't pay providers after the statutory deadline. It's a big mess. And CMS has frozen and unfrozen the process over the last few months, which has led to significant reduction in cash flows, leaving providers on the hook for tens of thousands of disputes. And while patients are still technically protected, these implementation challenges harm every single patient because they don't know whether providers are actually going to be there to provide the services that they need. So we've got to get this back on track, and I just want to know that I'm willing to work with you and others to get this in the right place. In the budget, HHS requested another $500 million to implement this bill, but I don't see evidence that it's gone well or right by congressional intent. Can you give me your assessment of what's gone wrong and how you intend to reduce the backlogs and legally implement this bill?
First, thank you, Senator, for your work in helping us have this critical law passed. But secondly, I don't think you or I knew what it was going to come. And so let me ask for your help. I'm going to plead for your help. We're receiving more than 10 times the number of claims that anyone ever expected. And these arbitrators that are supposed to go through these claims are swamped. And remember, they don't get paid unless they adjudicate the claims. What we're finding is that way too many, I want to say the vast majority, but way too many are frivolous because there's no cost to file a claim. So everyone's just filing all sorts of claims. And these arbitrators are trying to figure out what cases to handle. That's what's bogging down the system. But I will tell you this, we are staying true to the law. We are not letting patients get caught in this food fight between the provider of the care and the insurance company that has to pay for the care. We're making sure patients are not getting the bills in the mail saying you owe this money. It's going to be between the provider and the insurer. And what we're trying to do is have a system that works. So I plead with you and your colleagues, help us make sure that we get to the legitimate cases so a provider who's looking for real payment or an insurer who's saying, hey, you're asking for too much, we can adjudicate that claim.
Okay. Well, I've got another question I want to ask, but I think we have, I don't know whose fault it is, but we have a system that doesn't work, I think. And so I certainly will help, and volunteer Senator Hassan and Senator Cassidy, too, to figure out how we can all work together to do it. Secretary,
I'm writing names down.
Well, you should only write my name down 3 times, but I'll try to get the other folks. And I want to say again, thanks for your leadership. And just a few months ago, as the chairman knows, the CDC put out their latest youth mental health report. It continued what I've heard across Colorado over just the past few years. We have a youth mental health epidemic in America, a mental health crisis in America. According to the CDC report, 40% of high school students felt so sad or hopeless last year that they couldn't engage in their regular activities for at least 2 weeks. I was saying to my staff the other day that, you know, when I get a call from Colorado that somebody the age of my daughters has died, you know, I no longer ask, was it a car accident or was it leukemia? The question is, you know, was it suicide or was it fentanyl or was it a gun? And by the way, when I was the superintendent of the Denver Public Schools, we never asked that question, just 15 years ago. It's also true for seniors. You know, 1 in 5 Medicare beneficiaries have a mental health condition, and among Latino seniors, that goes up to nearly 1 in 3. I know we've done a lot in this committee on mental health, but we've got to do more, and I'm glad the HHS budget calls for parity in Medicare Advantage and invests in integrated mental health into primary care. This is why I introduced with Senator Wyden, Chairman Wyden, the Better Mental Health Care Act for Americans. Our bill would require parity for Medicare Advantage plans, Part D and Medicaid, and increase reimbursement across programs for integrated care. I am extremely grateful. I'm coming to the end of my question. I know I'm out of time. I'm extremely grateful to your staff for working with us to draft that bill, and I just want to ask you, as we continue to work on it, whether you'd be willing to work with us on it, because I'm sure you're detecting the same trends in mental health that we are, and maybe with just 5 seconds you could answer.
1 second, yes.
Yeah, good. Thank you. Thank you, Mr. Chairman.
Thank you, Senator Bennet, and thank you for your leadership on this. It takes your breath away what some of these gaps are. You know, we know in Eugene, Oregon, for example, if a young person has a problem in school, in effect has a major breakdown, there is literally no treatment bed for them
Right.
at that time.
Yeah.
So you're doing incredibly important work.